Hi everyone, we are back with another session with Hirad EP. Please subscribe, and if you like, please um, like the videos. And we are going to continue the review. This is part 9 today, and today our focus is on the help of the devices, including pacemaker, defibrillator systems, on preventing and treatment of atrial fibrillation. So it's not much information. There are 4 important messages from the guidelines that we're going to talk about, and also we're going to go over the evidence behind it. So we have a short video today. Okay, so let's start and let's talk about it. Okay, let's start to talk about the role of pacemaker ICD for prevention and treatment of atrial fibrillation. So there are 2 important things we are discussing here. One, if somebody has pacemaker, how we can decrease the incidence of atrial fibrillation. So if somebody get a pacemaker because of sinus node dysfunction, if you minimize the right ventricular pacing, you significantly decrease the incidence of atrial fibrillation. So that's number 1. Now the two other thing that I'm going to talk here is thus pacing features can prevent or treat atrial fibrillation. So there was a study, they're all small studies, but there's a major study, Minerva trial, that we're going to talk about in the next slide, that showed in patients that have relatively organized atrial activation, most likely due reentry, so they have some sort of atrial flutter. If you do have these pacing system in the atrium that can override and terminate these flutter or organized atrial activities, you might decrease. There's a moderately effectiveness in decreasing progression of paroxysmal AFib to persistent AFib. So there might be some benefit there. And however, they didn't find anything significant in pacing to suppress atrial ectopy. So if you have PACs, or if you think if you increase your heart rate in atrium, like pacing faster, like instead of 50, 60 to 70, 80, and that might suppress or decrease incidence of atrial fibrillation, that turns out to not be true. So initial data was more promising, but the randomized control trial and later trials showed that's not the case. So you don't get any benefit. As you see here, in patients with AFib, especially atrial pacing algorithms designed to suppress AFib, are not useful to reduce the incidence of or slowing the progression of atrial fibrillation. So we're talking about no benefit here. You can see with my marker. And finally, if you have a patient that needs a lot of V-pacing, and you have slow atrial fibrillation, so you're worried the patient gets right ventricle pacing more than usual, is recommended to use conduction system pacing, physiologic pacing system, because there are some evidence that you might be able to decrease progression or incidence of burden of atrial fibrillation. So these are important things I wanted to remember. One is try to minimize ventricular pacing. 2, make sure that you don't turn on atrial ectopy suppression, because there's not much of benefit. And the third one is, in some category of patients, have organized AFib, they have more atrial flutter. These reactive ATP or antitachycardia pacing features can help. All right, so few sentences here, few trials that I want to go over it. One is the MOST trial and the meta-analysis after one. This is the one that focused with the pacing the right ventricle. They found that the pacing needs to decrease significantly, even less than 10%, that you get significant drop in incidence of atrial fibrillation. So that's important, And then we have a Minerva trial that I already talked to you about, that they looked at antitachycardia pacing in atrium for the patients that have more organized atrial activity. There was modestly effective at decreasing the progression of atrial fibrillation and decreasing the burden. And then the last one is ATTEST trial. One of the trials, they look into efficacy of atrial pacing algorithms for AFib reduction, and there was no benefit. All right, everyone. So next week going to be Heart Rhythm Society meeting at San Diego. I'm not going to publish any kind of video then, and then the week after we're going to talk about interesting stuff or cool things that we came across during the Heart Rhythm Society meeting in San Diego at the end of April. Alrighty, so stay tuned for the couple weeks from now, and thank you very much again, and please don't forget do subscribe. Thank you.